Hi, I'm Dr. Scott Parker, Vice President of Clinical Affairs for DECA Dental Lasers. Thank you for joining us today. I'd like to talk today about increasing your revenue and improving your case outcomes with laser therapy. So one of the questions I like to ask when we start this type of conversation is, what is the most valuable asset in your practice? Is it technology? Is it your cone beam? Is it your handpiece? Is it your magnification? Is it your communication, how you communicate with your patients? Is it your employees? We all know employees can make an office. Or is it your skills? I would propose to you that your most valuable asset in your practice is your time, how you manage time. And when we're more efficient with procedures, we're more profitable. So one of the benefits of using lasers is we can do procedures very quickly. One of the advantages of using lasers are things like tongue and lip ties. We have to know why, we have to know when, we have to know how. When we have the right tools, we can make this procedure a very quick, a very efficient, and an excellent outcome procedure to make our profit more profitable. One of the things that I've heard other companies discuss is charring with lasers. If you look at this video, you'll notice there's no charring, and the reason for that is continuous wave CO2 lasers haven't been used in the market for over 30 years. We have super pulse lasers, we have ultra pulse lasers in CO2 technology, and we get incredible outcomes with very, very little scarring. In fact, scarring is less than with traditional procedures, such as, say, a scalpel or scissors, because of less recruitment of contractile tissue, myofibril. So, nice and clean procedures. This video will walk you through some of the reasons we might be doing tongue ties.
In order for effective breastfeeding to occur, a good latch is required between the infant mouth and the breast. An effective latch requires a few things from the infant. The mouth is widely open with lips that are flared or curled out. The tongue is extended over the gum and under the nipple. The nipple needs to be fully inserted into the mouth, including some or all of the areola. If any of these factors are missing, breastfeeding may become ineffective. Symptoms for the mother include prolonged feedings, painful nipples, and decreased milk production, while infants may exhibit noisy suckling and gas pains. A normal infant tongue has good mobility. Tongue tie is when the tongue is stuck to the floor of the mouth, preventing adequate mobility, which leads to an ineffective latch. The tongue tie may also be hidden under the mucosal lining, a condition called posterior tongue tie. With tongue tie, the tongue tip does not extend over the gum, causing the newborn's gum to chew on the nipple during feeding. Also, the up-down motion of the tongue is hindered, preventing an adequate suck, resulting in decreased milk production. A surgical procedure called tongue tie release can easily correct this cause of ineffective breastfeeding. Upper lip tie is when the newborn's upper lip does not curl up or flare out enough, resulting in loss of suction and the nipple to be incompletely engaged within the mouth. A surgical procedure called upper lip tie release can easily correct this cause of ineffective breastfeeding.
So the benefits of using lasers, again, are nice and clean surgery. If you notice in this video, we can use our laser to gain access to the tissue, and we can do maybe even a blunt dissection with a cotton applicator. Very clean, very nice way to do it. And in the right hands, we can get excellent results with this. We don't have to use the laser for the whole procedure. A laser is just a tool that we use for making our procedures better. We can use all kinds of different techniques, maybe to grasp the tissue so we have better control when we're cutting. These types of things are what make the procedure better, but it's not the ultimate solution. We have to work our way through the whole procedure and use all the tools that we have available. It's not just one tool that solves all the problems. When we look at the final outcomes, we can see what a beautiful result we can get with a laser. There's going to be minimal scarring in a case like this. A next topic that a lot of people like to discuss right now, which is becoming really popular, is using lasers to manage our snoring and our sleep challenges. So not only can we profit from them by using our physical procedures, we can also use these to do things like sleep apnea and also our snoring therapy. So traditionally, our non-surgical approaches, we would recommend things like weight loss, hormone therapy, including vitamin D, avoiding alcohol before we go to bed, decongestants, positional sleep, oral appliances, CPAP, our gold standard for sleep apnea, and now we're introducing lasers. So how do these lasers work, and what's the difference between a cutting laser and a fractional laser? A fractional laser, we take the beam of light and we split it into 100 pinpoint beams of light. So instead of a larger beam of light, we have a bunch of little micro punctures. We don't ablate the whole surface of the tissue. We actually make little tiny vertical columns. Those vertical columns push the energy down into the basilar layer, so down into the lamina propria, where we stimulate collagen formation. Now with the right wavelength of laser, you can actually make that vertical column so it not only alters the surface, but also we can affect the surface below, which is our lamina propria, again, where all our collagen resides. Without that technology, we would have to use a combination of lasers, which takes more time to get down into that deeper layer. We can change the pitch or the distance between each of these spots. It's very versatile. So during the treatment, we create a bunch of tiny thermal wounds, and the body responds by healing the surface of that. We're very familiar with this in facial ablation or facial aesthetics. We use fractional ablation to do fractional resurfacing of the skin. Well, we're doing the same thing on the mucosal tissues inside the mouth. So imagine this is a soft palate. We expose the surface with all of these little pinpoint punctures, the fractional ablation, and each one of those is a vertical column that goes down into the lamina propria layer. So this graphic represents stimulating down into those deeper layers of the lamina propria, which is where we stimulate the fibrocytes. Fibrocytes convert to fibroblasts. Fibroblasts are what are responsible for the deposition of new collagen, neocollagenesis. So the release of all these molecules leads to the release of high hyaluronic acid, which we all know is what improves the tone of our collagen. So fractional ablation can be very beneficial for stimulating new collagen down in this layer. The depth of penetration, I think this is probably the most important slide anybody using lasers in dentistry should know and understand. The depth of penetration of the two on the right, your diode and your Nd:YAG, they can penetrate as much as 3 and 4 millimeters beyond the surface where you're working. This can be a problem if you're uncovering an implant because we might be affecting the surface of the implant with heat and not even know it because it's down deep in the tissue. The erbium and the CO2, the second and third on the left, those are superficially penetrating, they're targeting water. So 10 microns to 100 microns depending on what you use. Again, we want to get through to that lamina propria layer where we have to use a combination with certain lasers. With CO2, we can get through into that lamina propria in one pass. And the magic is actually this little heat response, this little tail, this little thermal effect that comes off of the ablation zone, which is what stimulates your collagen. We get two effects. We get an initial shrinkage, which is what happens with the superficial puncture, and that skin tightens almost immediately. Overnight, our patients will notice the difference in the tone of their voice. But after that, about 7 days in, the new collagen starts to form, and that's what really gives us our lasting effect. A great time to re-stimulate is at the 21 to 28 day mark. If we look at it histologically, we can see what's happening below the tissue, and this continues to affect the collagen for as much as 3 months. So compared to other wavelengths, CO2 gives deeper penetration into the tissue, which means better stimulation of collagen, and that superficial fractional ablation leads to the more immediate relief. The areas that we target, we're targeting the soft palate and all of the structures on the soft palate because we want to tighten up that drum head and we want to change the resonance of that. So we're stiffening up, we're tightening, we're improving the tone of the soft palate. We can also hit the uvula and the arches, and it's really important for us to also focus on the back of the tongue. The back of the tongue is where our lingual tonsils are, and so we often see some swelling in that. There's no problem with hitting tonsils too because we can decontaminate the surface of the tonsil, which will cause that to shrink. We also treat the lateral border of the tongue. This is a really easy area for us to treat, but we don't need to come any further forward than halfway because there's no benefit from doing that. And again, the back of the tongue is really important for us to treat. If we look at it in operation, if you see this close up, you'll see the little tiny white pinpoints happening. And if we look at the picture of this when it's done, you'll actually notice this little grid that we've formed on the surface. That's what confirms that we've done fractional ablation on the surface of the soft palate. That's what really tightens up the tone. For measuring results, there's a lot of ways we can do this. We can do it with a cone beam to verify the volumetric changes. We can measure with a pharyngometer, which is a great way to measure true volume of airflow. We can track our sleep with audible sleep trackers, whether that's a Ring or a WatchPat, sleep studies, Snore Lab, fitness trackers. All of those are important for us to track. If we look at results over time, even after one treatment, we see a 15% reduction in AHI. In this case, there was a 28% reduction in RDI. In another case, we had a 50% reduction in AHI, a lower reduction in RDI. On average, we're seeing a 20 to 40% reduction in AHI after 2 treatments with the Quiet Night treatment. And we do this prior to oral appliance therapy. It doesn't mean that we recommend not using oral appliances or CPAP. We use this in addition to. We treat in conjunction with oral appliance therapy, and we're seeing incredible results with this. Again, another case, dropping AHI from 25 to 14 with 2 treatments, and then we titrate with our oral appliance. Our volumetric changes we verify with pharyngometer studies. In this image, you can see the improvement after treating tonsils. This is the day after treatment. We see a serious reduction in the surface volume of the tonsils, and that's because we're disinfecting the surface of the tonsil. To be clear, we are not removing, we are not ablating out the tonsil, we're only decontaminating the surface. From a Mallampati view, we see a dilation of that airway for improved airflow. And if we look at snore results, we're seeing this trend. This is after just one treatment. We see the trend of snoring slowly going down. Volumetrically, what it sounds like is a loud snore. And the after is much quieter. So, fractional ablation treatment was developed to create an alternative to aggressive surgeries. It gives us options for those that can't afford or don't want to afford our oral appliance therapy. We reduce the risk of adverse events because fractional ablation is very small and very easy to do. We reduce our downtime, we reduce snoring, we improve our patient's quality of life, and important for us, we improve our business revenue. And we can maximize our business revenue not only by treating fractional sleep patients, but we also do these therapies like lip and tongue ties, snoring, perio, hygiene, distal wedge, all of these different treatments we can do. There's a tangible ROI, and there's also an intangible ROI. Intangible ROIs are making our lives better, but we don't necessarily charge for those procedures. Maybe using your laser to do the incision versus a scalpel, where we see less inflammation, less swelling, and less pain postoperatively. Again, what is the most valuable in your practice other than time? I would say it's you. And I want you to think about these things. We're happy to ask questions. We're grateful for your time to listen today. Thank you for watching. Thank you, Seattle Study Club. And I hope you have a great day.